In 2020, make no mistake about it, Medicare for All is a litmus test. And if the candidates don't endorse Medicare for All unequivocally, then they're going to have a hard time winning over the left. Now, a lot of candidates are at least savvy enough to know that they've got to talk Medicare for All if they want to appeal to the base. Because now we're at a time when 70% of Americans support Medicare for All, and that includes a majority of Republicans. So even if they don't support Medicare for All, they're going to try to convince us that they do. So for example, Pete Buttigieg, he doesn't support Medicare for All. He made this very clear at the CNN town hall with him. So he's calling his public option Medicare for All who want it. So do you see what's happening? They know they've got to convince us that they support Medicare for All, but up until this point, as far as I know, there's been 3 candidates who have not backtracked on Medicare for All: Bernie Sanders, Tulsi Gabbard, and Andrew Yang. Even Elizabeth Warren has started to walk away from her Medicare for All proposal and has signaled to us that she's willing to compromise. Unacceptable. Now, Beto O'Rourke is someone who, all throughout his Senate campaign back in 2018, he wouldn't endorse Medicare for All. Kyle Kulinski, one of the co-founders of Justice Democrats, has explained that he was actually in talks to become a Justice Democrat, but one of the key issues that was keeping him from joining was his unwillingness to support Medicare for All. Now, he has an excuse that he's long maintained that, well, look, I never co-sponsored H.R. 676, which was John Conyers' Medicare for All bill, because I just don't like some of the provisions, but if I'm elected as a senator, I would support Bernie Sanders' Medicare for All bill. Now, why is that not persuasive? Because these bills aren't really that different. The difference between John Conyers' bill and Bernie Sanders' bill is that Bernie Sanders' bill is actually a little bit weaker. It doesn't have long-term care, although he did admit recently that he's willing to add that. It's a more gradual rollout over the course of 4 years, although Bernie Sanders, I believe, wants his bill to match Pramila Jayapal's bill now, which is a 2-year rollout. So, I mean, the point is that if you're saying that you're unwilling to support H.R. 676, but you're willing to support Bernie Sanders' bill in the event he was elected, that tells me you're a bullshitter, because the differences are not that substantial to where you would just not support H.R. 676. So it tells me that he doesn't want to support Medicare for All. But now that he's running, this question is going to come up again. And he was asked what he thinks about Medicare for All, and he failed miserably on this because he indicated that he does not support Medicare for All. And yet again, he is refusing to commit to supporting Medicare for All. And what he says is absurd here.
Medicare for All is championed by some of your new competitors.
Right.
You get asked about it. How quickly are you going to promise voters that you get there?
I think we have to begin with a goal that has to be separate from any labels. And that goal has to be that every single one of us can see a doctor, take our child to a therapist, afford our prescriptions, to be well enough to live to our full potential, to get that education, to work that job, start that business, write that poem, run for that office. That will truly allow this country to thrive. And so the quickest way to get there, in my mind, is to ensure that we protect the safeguards that we already have, to bring as many people in as quickly as possible into guaranteed health care, expansion of Medicaid in those states that haven't done it, allow people to buy in to Medicare who are not already covered by employer insurance, and ensure that there is an effective guarantee so that even if you have insurance but are unable to afford the copay. We just met a woman in Keokuk who says her daughter's copay on her medication is $444 after insurance kicks in, that we guarantee you that you're going to get the care, or the medication in this case, that you need. So my goal is to do that as quickly as possible. I'm convinced that we will have to work from as much common ground as possible. No one person, and perhaps no one party, can force the decision on this. This has to be something that America comes together on. And I think you do that by listening to people, by listening to patients and doctors and healthcare advocates and communities. And from that, you get to the solution. So I'm very, very excited that it is such a dominant part of just about every candidate's proposal to do better for this country. I think it's a good sign that we will get there. But we have to make sure that we include every single person we can in the solution for this.
So the first thing he gets wrong is he says, quote, "I think we have to begin with a goal that has to be separate from any labels." Wrong. Because if you are trying to get a policy through, then why wouldn't you prop up a policy that, one, has name recognition, Medicare for all, and two, has the overwhelming majority of Americans support it? Why would you try to go for something else? That's one of the biggest red flags. He also says the quickest way to get there, meaning Medicare for all, in my mind, is to ensure we protect the safeguards that we already have. In other words, look, if we want to get to Medicare for all, what we first have to do is protect the ACA, expand Medicaid. Well, it's funny because I thought that the quickest way to get to Medicare for all was to just pass a fucking Medicare for all bill. But what he's saying is, no, we actually have to do what isn't the quickest way, and that'll be the quickest way. I mean, it makes no sense. The opposite is true. So is it clear to you yet that what he's doing is he's bullshitting? He's trying to do this tap dance around Medicare for all and pretend as if he supports it, but really, he's telling you, I don't support Medicare for all in a roundabout way. He's functionally against it, and he's only for maintaining the status quo, Obamacare. Now, here's what he also gets wrong. Quote, "I'm convinced we'll have to work from as much common ground as possible. No one person, perhaps no one party, can force the decision on us." This is one of the weakest responses yet. Because think about this. What did Republicans do when Obama introduced Romneycare? A right-wing healthcare reform policy that was cooked up by the right-wing think tank, the Heritage Foundation. What did they do? They didn't support you. Obama took this approach. Obama tried to reach across the aisle, and they slapped his hand down. But now, after seeing what played out during the healthcare debates of 2009 and 2010, you are still delusional enough to say, oh, well, we need to find common ground. Hey, Beto, guess what? Regardless of how much you try to shove hope and change down our throats, Republicans aren't buying it. They're not working with you. So if you want to get any reforms through, including their own policies, they're by default going to be against that. So what you have to do is beat them. You're not going to find common ground here. They're about rolling back what we've managed to accomplish with the Affordable Care Act. In fact, Trump's administration currently is suing to undo protections for pre-existing conditions. So the fact that you even are floating this idea of common ground on this issue, I mean, it honestly is borderline delusional, but we all know that Beto O'Rourke is not delusional. He's a very intelligent individual, but what he's doing is gaslighting you. This is a bullshitter who wants you to think, I support Medicare for all. I'm going to tell you I support it, but, there's a number of ways that we can get there. First, we have to start by protecting the Affordable Care Act and doing this and doing that. No, the fastest way to get there, you just codify that bill into law, pass it through the House, the Senate, and then you sign it into law. Really not that difficult. There's no stepping stones that you're required to go to first in order to secure Medicare for all. You could just pass it, and then it's passed. It's codified into law. So, I mean, he's a bullshitter. And yet he's trying to say, well, we can't force this. We've got to have bipartisanship here. Unbelievably delusional there. So understand what Beto O'Rourke is. He is white Obama. He's white Obama. He's going to try to do what Obama tried and failed at doing, which is reaching a consensus. And then for the next 4 to 8 years, if he were president, people are going to get increasingly more desperate. And then we're going to elect an even bigger monster in 2028 or 2024 on the right. Because every time Americans get desperate, and it's not just Americans, it's people around the world, whenever they get desperate, they opt for a radical who can capitalize and exploit their feelings of desperation. How do you think Jair Bolsonaro got elected in Brazil? How do you think Marine Le Pen almost got elected multiple times now? She made it to the runoff on 2 different elections. How do you think she got that far? It's because people are desperate, and when they are desperate, they are susceptible to radicalization. And a lot of times, people who wouldn't otherwise feel inclined to agree with the policy positions of a right-wing proto-fascist, well, maybe they'll choose to overlook some of the really damaging ideologies that they're espousing in order to get some economic relief. So that's what we can expect if Beto O'Rourke was elected. So I don't know how far he's going to go in this race, but what he brings to the table is vague platitudes. He's not offering anything specific, and he's trying to talk about reaching across the aisle at a time when you're trying to work with a party who is insane. Republicans are essentially a psychopathic death cult, and you're trying to work with them? I mean, this guy doesn't know what he's in for. They're going to eat you alive, Beto, if you try to work with them. So you have to defeat them and pass policies in spite of them, not try to bring them to the table because they wouldn't do the same with you. Look at the tax bill. So, needless to say, he doesn't support Medicare for all, and a lot of candidates will be using the words Medicare for all and getting to Medicare for all, but listen very carefully when they say things like this, because what they're effectively telling you is, I don't support Medicare for all, but I really hope that you think I do so I can pass your litmus test.
Mike is a total loser, so don't hit the subscribe button, okay? And whatever you do, folks, do not hit the notification bell either. Mike treats me so unfairly.